Well, and guys, this is really the first time that we've sit down since we've started, doing X amount of podcasts. I think we've done one. We've done about what 7 to 8
podcasts.
Completed 7. 9 I'm getting over here.
It depends on which.
Completed 7.
10. I'll go 10.
10.
Do
I have 11?
Not there yet.
Soon. But yes, so we've done about 8 or 9 podcasts so far, and this is the first time we've actually kind of had the chance to sit down and recap and really discuss, the kind of the lessons that we've learned and our experiences with that. So can we attempt to try to pull back from our memories and think about some of the good times that we've had over the last couple of months?
Well, I'd like to go way back to the beginning. The beginning of the eClinicalWorks podcast as it is today.
What an excellent place to start.
And talk
The
about
beginning is usually a good spot.
it's a good place. Some places begin in the middle, but the beginning for us was this whole idea, this whole mission that we took upon ourselves, right? So I mean, what is everybody's take on that?
Well, initially we saw that there was, obviously an interest in the industry for podcasts. I was one of the few people on the team who had experience with podcasts in the past, and that was more of a news media type thing that I honestly never thought it would be brought into health in-care, health IT, right. Let alone specifically eClinicalWorks. But the people that we visited on podcast, what was it, 5? The Vaughns?
Dr. Vaughns,
yes.
Yeah, you went there. That's what I'm looking at you.
Yeah. That's right. Well, I mean, it's hard.
Yeah.
The numbers. I mean, some people I go by content instead of numbers.
Sorry. So our podcast with the Vaughns, they were actually the people that we saw do something like this first. They did an eCW podcast way back in what was it? 11?
Yeah,
2011, 2012.
2011. But I mean, theirs is always focused on like product content.
Right. Yes.
What they learned using
what they
the
learned
software.
using software and how they could help other people.
It was more a sounding board for
Exactly.
expert users. It was kind of like eCWusers.com, the forum,
exactly.
where people can kind of share their ideas and talk about experiences with the program. Whereas we kind of said, okay, let's take that idea and make it more of a human interest piece to show how eClinicalWorks not necessarily is one of the better softwares out there from a sales perspective, but from the perspective of helping people in their day-to-day jobs as well as their day-to-day healthcare. How's it affecting patients? How's it affecting physicians and their staff?
Absolutely. It also, I think, created a nice platform for spotlight on certain clients that really reach out to us a lot. At the same time, we can reach out to them, whether it's for a reference or to help in that sales process, which a lot of things revolve around that. But we wanted to get outside of just that sales process and really get to know the clients. Let them talk about why they chose eClinicalWorks and how it really works for them, whether it's for patient engagement, meaningful use. I mean, I know for those that have been our listeners and following, you've heard, we've done a lot of patient engagement. We've done a lot with meaningful use, but as the software evolves and gets larger and bigger, I think we're always going to jump into different, avenues, different areas, health centers and whatnot. So it's really kind of important in that regard that we use it as a platform to get their voice heard, not just our voice.
Well, we also need to make sure that we keep in mind that with the technology that we're evolving, because we're involving our product on a daily basis, that our clients are evolving with the technology, and we need to be able to reach them in all these different forms of media to be able to keep in contact and let them know that we are growing as an organization. And keep in mind all of the products with all the changes and all the things in V10 that we've just released. Everyone can use our product in different formats. There's so many different ways to do similar workflows, and it's always better for our clients to learn from other peers that may be able to connect better for them from their perspective, like a peer-to-peer communication, saying like...
Right, and we've seen that. I mean, we've
Right.
seen different people use one product in multiple different ways that we might not have even intended, but that ultimately works for them and their patients.
Absolutely.
Absolutely.
So let's go back to some of the early podcasts and how much of a learning experience this has been for us. I mean, look at the microphones that we've got.
The microphone
microphone
today.
Beautiful professional.
These professional microphones.
Yeah.
Oh, I'm sorry. I'm not supposed to touch it.
Yeah, don't
That's a
touch
noise.
Our first episode, what we did was meaningful use, because it was a
Yep.
huge topic that was going on out there.
That was Adam and Liz Schreiner talking about
Yeah.
meaningful use, part 1.
Part one, and you'll notice that there is no video portion to our first podcast.
We had this great intro, this very dynamic hip hop, like
so
high
happy,
energy
Everybody's
intro.
But It's all audio.
Right.
It's just because when we went back and rewatched it, the audio was great. She had a great message that she wanted to be sharing and be able to answer a lot of clients' questions that we get all the time. But yet in the video, you saw a black circle.
Well,
Right.
and
I think something.
And initially, when we set it up, we really didn't think, because we had seen a lot of video versions of podcasts where, you know, it was kind of almost like at a radio studio where
Right.
you had you know, the
Exactly.
on-air sign in the background and the big you know, microphone with the condenser you know, filter on top, and you know, we didn't really think about, okay, well, while filming this, that's gonna be here, you know. We had you couldn't even see poor
Right.
Liz's
Yeah,
face.
in case anybody's wondering,
Yes,
it's
this is a
big
pop
thing.
filter.
The pop filter.
Which normally you'd put over this, but we just got better microphones, so now we don't need those anymore.
Yeah.
So yeah,
Right. So Liz Schreiner, the little Liz Schreiner, she's got this gigantic black circle in front of her face. All you can see is her eyes.
You
Yeah.
too. I mean, you can barely see your face.
Well,
You could barely see yours too.
Yeah,
It wasn't
true.
as, you know, it was kind of on both sides. But for our listeners, if you watch the intro to
Yeah.
the podcast,
You can see
you
it.
can pause it.
Yep.
It's kind of towards the end of the intro, and you will see Liz Schreiner, our great friend, with a giant black pop filter over her
It's
face.
just one of these talking at you, answering questions. I didn't know they were smart. It's become self-aware.
So we've come a long way. I mean, obviously that first one was audio only. Then
Mm-hmm.
we switched over to more video related. We learned from our different trips to go to client
Well,
sites and
And again, at that point, our mission statement really hadn't been solidified, so we were still
Absolutely.
kind of getting a feel of, you know, how we wanted to go about this. Initially, we said meaningful use would be the best option to do as a topic for the first podcast, just because it was such a hot topic at that time. Meaningful use stage 2 had just started, and a lot of people had questions. So, you know, obviously that was a perfect example for us to
Absolutely.
to go in there with that topic.
It's still kind of a hot topic. I mean,
Yeah,
I think Erin was
absolutely.
talking about some updates.
We have major
Earlier
deadlines
today.
coming up in October 1st. We just finished a deadline for those that are trying to attest for their 90 days back in July 1st. So those individuals are coming up now for their 90-day attestation starting October 1st, in addition to those for Medicare that are doing their quarterly reporting, because once you get past your first year of 90 days, you got to do a quarter. And then that's also starting October 1st of this year. For those individuals that haven't chosen a medical record that is meaningfully use certified, their first penalty year is now, and they need to start using one as of October 1st of this year before they get any more penalties.
Was it get dinged, what, 1%? Was
yeah,
it?
it's
Yeah, it's 1%
1%
for the
starting
first year.
January 1st, 2015. If they haven't done
Cumulative.
stage 1,
Well, and as a you know, recap to episode 1, we also did in episode 7 with Catherine
Yep.
another review of kind of talking about some updates to it as well. So and we do plan on doing that going forward in the future as well.
Absolutely.
So definitely, you know, keep an ear out for that. We will
Yeah.
be addressing meaningful use throughout the entire the
Entire
entirety
cycle.
of it. Really, I mean,
it's
all the way
always
through
going to be a
stage 3.
hot topic until it's
Until
over.
it's
Really,
finished.
I mean.
Well,
it's-
and really, will it ever be over, or will it just be called Medicare's new policy?
Yeah,
Medicaid's
that's
new policy.
the-
You
Well,
know,
we're just
that's
they're
the
gonna
real
rename
pusher.
it, just like the PQRS programs. And then
True.
we'll have a new program to replace the meaningful use program to go forward while
Though-
they're working.
Though I'm pretty sure Adam likes the fact that it's a hot topic because he likes to remind us that he has the highest viewership of all
does.
podcasts.
He does.
Single viewed
it was our best
Course
podcast.
So, and there's no
Well,
video, and it's the best one.
Yeah, that's why people liked it so much, because they couldn't see my ugly mug. But yeah. So sorry, go ahead.
No. Well, I was just gonna say that then after our first internal podcast where we kind of learned the ropes a little bit, we went on the road. Erin went on the road
Yep, that
for
was the
our
first
very
one.
first client-based podcast.
Yes, down in San Antonio with Dr. Dominguez at Health Texas Medical Group, which I probably said about 18 to 25 times throughout the podcast. Just, you know, pitching them in the case. Well, it was really nice. We went down there. They brought us into their office. They set up their back room, kind of like a little, you know, nice little boardroom like this. And we just kind of had that initial discussion about eClinical Mobile. But yeah, down there we talked quite a bit about their experiences with really the entire product. They used pretty much everything, mobile, portal. They really ran the gamut. And they actually had a couple of interesting stories of how he's, again, used mobile to kind of stay connected, practices who, you know, or patients who needed healthcare, you know, in a pinch, you know, if they're out on the road, if they're in another country or whatever it may be. He was actually one of the guys back at the users conference 2-3 years ago, where we had a little video where the video department put together a couple of really amazing stories about how mobile kind of almost, I won't say saved someone's life, but pretty much did, without being too hyper-sensationalizing the program. But and then another thing that we also learned about that was consistency, which is another thing that we've always tried to strive for here at eClinicalWorks.
Yes. Well, are you referring to the consistency of your haircut during that episode?
Yeah, I'm talking about my hairline, actually. Because that was the episode where we also did our first subject matter expert
Yes.
Q&A portion.
The Q&A.
And if you watch that show, while I'm interviewing Dr. Dominguez, I have hair. And if you watch the Q&A portion with me and Damien, well, I don't. So it's like, who's that guy? No, it's really me.
It's his evil twin right now. He just
Yes,
come back.
I am the evil twin version of Erin Ibrahimi.
Which brings up a great point about sitting down with our product specialists to talk about these questions from our clients. Please send us more questions. We want to get these questions in. You can just get us on our email. It's just podcast@eClinicalWorks.com. Please send us questions. It could not even be related to a future podcast. We like to keep them on file, and maybe your question will get on the air. We'll see.
And
It'll be
to
fun.
hear your name.
Speaking of consistency,
Ooh.
I'd like to go back and see if this is true or not. But I think after that podcast, I think we have a plant in every
Oh my
interview
Yes.
after that.
Yes.
We always
I-
have to have a plant.
It adds to the ambiance.
We
We
don't
don't
have
except
one.
here. We don't have
Somebody
one.
get
We
us
don't
a
have one.
plant.
We need a plant.
No!
Take one from the front lobby.
But yes, we usually do have like a ficus or something
Yeah,
in the background.
something.
That is kind of weird.
Something.
And I remember when we were in San Antonio, we were setting up the room, we were specifically like, let's put a plant in the background. Like, yeah, that's a decision I want to make. My interior decorating side just came out.
Over the coming year, you will see Hilo revolutionize patient engagement by reaching patients where they are with their smart reminders and automated communication. Leading the way is the Hilo app, a logical extension of the practice's portal, at no extra charge to you or your patient. 200,000 patients have already downloaded the app. Patients are hungry for better, easier communications with their doctors. Hilo will make patient engagement easy and natural for you, marketing your patient while increasing patient compliance and satisfaction. It's so easy to use. No special activation or configuration is necessary on your part. Your patient simply downloads the app and starts accessing the information you share with them via the portal by logging in with the same credentials. Hilo can help your patients manage chronic conditions, help them to improve their medication compliance, reach them where they are with the smart reminders and automated communication, and make getting an appointment to see you easier. Help your patients help themselves to online health and wellness with Hilo. Find more information at my.eclinicalworks.com.
Talking about mobile and how the native app and how all the different features that Dr. Dominguez was using in his practice brings us back to Dr. Mehta's in our episode 3, where they brought up an interesting story where they were on vacation, where they were able to communicate with one of their patients' parents and saying their child still had some fever or some other side effects that they were told to contact, and we're able to use mobile to look at the chart, look at the history, be able to send a prescription. I thought that was, it's an apt use for what mobile's designed for.
Yeah, I think it's a perfect case in point of this feature being used in a live environment by real doctors and allowing them to do what they want to do without having to lose connectivity to their practice.
Even on vacation, which is always an interesting item to do, but I think a lot of this stems out of the change in eClinical Mobile that happened, going back to actually going over to a native app, opposed to having
the past it was the web browser.
The web browser, which, not that the web browser is bad, but I think the adoption rate with the native app has steadily increased, and just additional features you get
Well, the
along with it.
usability factor in general. I mean, it's designed to be on the iOS versus the web app, which is basically porting our Microsoft application.
I remember
over.
setting up a doctor's office on eClinical Mobile when it was still the website, and it was this really little tiny thing, and you had to zoom, and then move it around to
You're
get to
trying to
where you
click
need
a
to go.
button.
And
Yes.
oh
Yeah.
God,
The buttons,
so
yeah.
much better now. So much better now.
So
The features also have greatly increased of the functionality of what the providers can use now. You have our rounding list. You can actually take photographs and have them uploaded directly to a patient's chart, which we didn't have before. And as well as you have the ability to have staff members to be able to assist you. Previously, it was specifically designed just for providers, and only they had access. But now we have supporting staff, PAs, nurse assistants, or anything that the physician could use in a dermatology practice, regular internal med, and any specialty. You could have those assistants.
Absolutely, absolutely.
Yeah, no, they really showcased, between the mobile podcast and some of the discussions that we had with the metas, it really did highlight what the native version of mobile can, be capable of.
Absolutely. New features and things of the nature have been added into the standalone program that we've had that's grown since 2005 to where we are today when the metas were started using eClinicalWorks with version 5 or version 6, because they're not really sure which version they had. It has grown exponentially. In addition to just features and enhancements in the system, we've also brought in different
New types of clients.
Different clients. We got health centers. You've got correctional modules. But to go back to the health center part, with episode 4, we had Dr. Wu, who went through and gave us such a great history of the community health centers and how they evolved and where we came from and how they're utilizing eClinicalWorks to meet the needs that are really different than the standalone practice than just what our PCPs use.
Yeah, I got to say that podcast was actually really interesting to me because initially when I heard the subject matter, I was kind of like, oh, okay, community health center, how interesting can it honestly be? But the history of it honestly was kind of interesting. I mean, it was much more of a refined feel to me, that show in general. But he was very professional. He was very to the point, and he shared a lot of interesting facts that you definitely would never have learned unless you listened to that show.
Absolutely, it really stressed like the history going into it, and I know we kind of get at him a few times with the whole thinker concept, but it really makes you put your thinking cap on and the constant thinker, right, Adam?
Hey, what else are you going to do? You're sitting here, you're on camera, you're listening to this person talk to you. You want to look interested. You don't want to look, distracted or bored because obviously you're not. But then through your head the whole time, you're like, oh, I bet I look distracted and bored. I got to do something that's like, so you overcompensate. And I guess that's my overcompensation is
just keep
the
doing
thinking.
Yeah,
That's what it is.
For like Christmas or something, I'm gonna get you that Banksy graffiti that's just got a monkey going like this.
I love
the
Banksy.
monkey thinker.
Amazing artist. But hey, I can't be the only one though. Okay?
No.
Oh, please! I told him
you're always thinking
No.
about what are you doing with your hands, and it's always interesting. Like, I need to have a pen in mind, and I'm using an iPad because that makes perfect sense.
This is your pen.
I know. But I have a pen in my hand. Just do something with my hand.
Yeah.
That would damage the
keep it
iPad.
occupied.
Well, the other thing about Dr. Wu's podcast is that it really felt like we moved to like the big time, because before that I was still wearing the polo in that shirt.
Yeah,
Yeah.
was that the
That
last?
was the last one. That was the last one.
One of the last. Actually, no, we wore it in the
we-
Vons too.
Was
But
it in the
the
Vons
board,
too? Okay.
yeah, we did it in that one too. But it really just kind of felt very professional. It felt very
Newscaster.
not Nightline. Is that a show?
Nightline is a
Nightline.
show.
Okay,
It is a
yes.
show.
Like that kind of a show. I don't know. I've never seen it.
Well, no, you're right. It felt a lot more like a news report. Like if you were watching something on CNN or Fox or MSN and they cut to somebody talking to a medical director or CEO of some other company, it was kind of like that setting, more, I don't know, office-like, rather than
The lobby.
doing it in the waiting room
Right.
of most of the practices, which is what we did at the metas. Not to say that it was a bad experience.
It was
just
a very
looked-
living room moment.
It looked like
speaking of living
exactly,
room,
exactly. It looked like I was on their couch hanging out at home.
we need a nice living room moment.
Now I feel
Plants.
complete.
It's complete.
Now I feel
The
so
fifth
complete.
member.
We got our plan. But,
Be sure to join us at the 2014 eClinicalWorks National Users Conference at the Orlando World Center Marriott in Orlando, Florida, October 17th through 20th. We encourage you to book your reservation early and to bring the family with you to this remarkable family destination. Please visit our registration website at specialevents.eclinicalworks.com to book your hotel and register for our 2014 National Users Conference.
The episodes of Dr. Vaughn as well as Dr. St. Clair, which both were really focused on the use of portal as well as patient engagement tools. And then, eClinicalWorks as a whole, we really pushed towards the patient engagement side of things. And we've had that large push going now for, over a year at least. I know Garish, Raj, and Mahesh have all been pushing that concept through the employees, but also down to, all of our clientele. Last year at the users conference was a big push on patient engagement, and I can only assume this year at the users conference is going to be another push towards patient engagement.
I think they're also doing, like, besides just pushing out to our clientele and then the practices to start using it, because it is a great tool for them to be able to focus more time on other areas. I think we're doing a big push from the patient engagement perspective to the actual patients themselves. Instead of going to the practices that are utilizing it, we're going to the people that need to have the education. So we've been doing like radio broadcasts in different areas to get people to start using the new Hilo app for patient engagement. There's just so many different things that eCW as an organization as a whole is trying to reach out and get that news out there, just so they can have that information.
Right, and of course you're talking about the aspect of Hilo where
Yes.
patients can find their doctor, book their own appointment based on the doctor's availability, of course.
Absolutely.
And get seen, right? I
Yeah.
mean, that's of course available everywhere now. I think we're promoting that everywhere, anywhere. If you're a provider and you're looking for a new and an engaging way to sync up with your existing patients or even new patients, the Hilo open access module
Open access
is going to be a great feature for you guys.
Yeah, it's putting the patient more in charge of their health care instead of the
Well,
insurance.
really, it allows them to book their own appointments based on.
But it allows you to find the physician in
Yeah,
your
listen.
area. So if you
Yes.
just move, so I can find
True.
someone based off maybe ratings or areas or something of that nature. So it allows me to have a little bit more control on who I'm seeing, what's my options, and do some more research.
True.
Right.
Absolutely, and that's one of the things, with this whole turn towards patient engagement, I know we're working hard with our patient engagement team. They kind of have like an account manager role, so when a client is interested in really adopting patient engagement and growing their patient engagement numbers, you can contact them. I'm sure we'll have the email pop up right below me while I'm talking. That way you can reach out, get in touch with an account manager, and help you improve your patient engagement numbers. But at the same time, we already have some tools available online. I just on our regular my.eClinicalWorks site, whether it's something as simple as a pamphlet or a handout that you want to get to your patients, real simple tools, but reach out to these patient engagement people. That's what they specialize in. That's what they do best.
Well, you even have tools and metrics right in your own system already. I mean, and that's something that I think people don't usually know about.
And they didn't even know about it.
They didn't even
when you
know
got
about
out there,
Yeah.
right?
Right, but then that was something
Yeah.
new to them. They were really excited to learn that they have in their patient portal admin section a place that shows them all of their patient portal statistics right there. So now instead of, I think we've talked about this a couple times with doctors, and in one of our upcoming podcasts where we spoke with folks from Denver Nephrology, they spoke about a certain experience where in the past they'd have to talk about how things felt, what their perceptions of things were, but now they've got data.
Yeah.
And so now with this whole patient engagement thing, this big unknown, this developing area of patient engagement, now you have numbers at your disposal so that we can, you can measure that. You can see if it's
they're
working for
And
you or not.
going back to meaningful use, I mean, with that, you're trying to hit a certain percentage of a threshold based on whatever the measure may be. So if you don't have that data, how do you know what area of your practice needs work or what you need to promote more or less? I mean, well, always more, I'm sure. You never promote it less. But you guys know what I mean. Without that information or the ability to capture and really turn it into usable data,
You have all
you're just kind of lost. You have the tool, but you can't use it.
You have all the information at your fingertips. Now let the system show you what you can do to broaden your horizon and make things more beneficial to you as an
absolutely.
organization.
And it's so interesting to see how these two different practices, and in case we've lost track of the practices that we're talking about Auburn Medical Group in California with Dr. Vaughn, and St. Clair Medical in New York with Dr. St. Clair, who are both using the patient portal, the Hilo patient portal in similar ways but different. It's kind of evolved in a different capacity. And it's so interesting to see that when you go back and you listen to these podcasts and you hear them talk about how they're using it in different ways. I think it's fascinating.
Well, and even to go back to the podcast with the Metas, they were using Patient Portal in a totally different way because they didn't have a Medicare or Medicaid population. They only enabled patients for the portal provided they paid a fee.
Yeah,
Because
pay per use.
Yeah, because they only wanted people who were really invested and wanted to use the tool. So they figured they'd attach a fee to it in order to get people to only sign up if they truly wanted it and were going to use it.
Yeah.
And yet another way.
Well, we're talking about all these different things, and how informed not only is the patient informed, but also the practice and how informed the practice is, and the importance in learning the software, delving deep into the software. In upcoming podcasts we do talk about training and just going through the process of training and learning the software and getting those details, and just how much more effective a practice can work with that information behind them, opposed to always in front of them while they're trying to reach out for it and never getting it.
And where's another place we can get access to training, Erin?
Oh my God, you can get them on the eClinicalWorks. We have tons of how-to videos as well as webinars available for you that you can utilize, that we're updating on a normal basis, as well as a national conference that is coming up in October. Is that what you wanted?
I was going to buzz you out. You were going to have a wrong answer, big X, but then you got it. You got it. Exactly what I was going for.
I'm promoting my own videos. Come on.
Yeah, definitely. In case anybody hasn't heard about it yet, I mean, we're obviously having our National Users Conference in Orlando, Florida this year.
Yes.
Later in October. But yeah, definitely join us for that, because we have training. We have all sorts of sessions that we conduct and that clients conduct. And you get to talk with all these people out there who've had these mounds and mounds of experience.
And there's this rumor going around that we may or may not do a live show.
It's not
What?
it's not a rumor.
Live podcast?
It's happening.
What?
I
It
believe
is
that's
happening.
happening.
We're going to have a live show.
We're gonna have probably
At the national conference.
We're going to be able to keep this guy censored for that long?
I'm not really worried about him.
Well, you can see his great thinking. For those who haven't seen the video, you'll get a chance to see Adam's thinking pose, because we'll pose some
It'll
questions
make an
to him.
appearance. It'll make an appearance. It's not so much censoring you have to worry about with me. It's take after take after take. I don't know about you guys, but when I do the intros or the outros or or the segues, sometimes it takes 2, 3, 4 takes to get it right, and it's.
I think
Yeah,
we've all been there.
I think in one outro of our Q&A, the Shmee session,
Yes.
I actually said, "Yeah, I'm here with Greg and Erin."
Yeah,
and
which-
pointed and looked at both of you.
Yes.
So yeah, I'm right there with you, man.
that was a great blooper moment, and I hope we can put together a nice little.
Sometimes I don't even
blooper
get
Yeah,
mine
someday
right.
we'll have enough to put together and do a full
I think I
blooper
introduced
podcast.
myself as Baron Momini at one point in time.
That's just silly.
It is.
So please come and find us at the national conference. We'll have our own little area
We'll
for the
all be there.
podcast. We'll
Yep.
all be there.
There's
You'll
gonna
be
be a
able
little
to.
zoned off area.
That we may
for the
or may
podcast.
not have cool things for people that come and listen to our podcast.
Well, we better have some swag to give away.
Oh, I guarantee we have swags, but will you be there in time to get the swag is the question. So come on out, listen to us. You'll be able to meet us, have involved in the banter. We'll be taking live questions from the audience for our people that we're having our podcast
Oh,
with.
can we have a T-shirt gun?
I think that's a hazard.
I don't think that's acceptable indoors. But
No, but we can maybe get a Nerf gun. How about a
What
water
about
gun?
those rubber band things? You can do that.
I was
Like
like a
slingshot.
slingshot?
I was just
Yeah.
gonna throw
He's
it.
there, David.
I was just
Put
gonna
an
throw
eye
it.
out.
All right. So we want to thank you all for listening to our roundtable discussion of going over the first 7 episodes of our eCW podcast. We look forward to you listening and sending in your questions for our upcoming podcast, which you can find on our YouTube page as well as our eClinicalWorks podcast page.
Yep.
For anyone that's interested in participating in one of our podcasts, please email us and reach out and let us know. We'd be super excited to touch base with you and see how we can integrate what you're looking for into one of our upcoming podcasts.
People have already been doing that too. We've got emails coming in from
Multiple.
people who are watching. It's great,
Yes.
great to see. Thank you so much for the people who have already contacted us. We greatly appreciate it.
Excellent. Yeah, thank you. And
Thanks.
And definitely send us your questions at podcast@eClinicalWorks.com.
yeah,
And we hope to see you at the national conference for our live podcasts.
This broadcast and its contents are the sole property of eClinicalWorks and are protected by federal law and international treaties. You are strictly prohibited from making a copy of, modification of, or form of rebroadcasting or re-encoding this broadcast without prior written permission from eClinicalWorks Public Relations, except as may be permitted by law. This broadcast is provided for informational purposes only. It is intended as a personal, non-commercial use. Product specifications are subject to change without notice. Please contact eClinicalWorks Public Relations with any questions. eClinicalWorks V10 EHR is ONC HIT 2014 edition certified as a complete EHR. eClinicalWorks V10 CC 2014 955447-1.